gratitude to everyone who can make it, because this is very important topic as we are now into the AI technology era. And this we can call as a big major transformation that we need to explore. Before we begin, let me introduce myself. My name is Warapat Ditpan. I am a research associate for International Trade and Health Program, International Health Policy Program, Thailand. Before we move on to the panel discussion part 1 and the part 2, we are very fortunate to have Dr. Sampan Simpanat, the chair of National Commission on International Trade Studies, to formally open the session for us. May I please invite Dr. Sampan Simpanat, the chair of National Commission on International Trade Studies, to deliver opening remarks for the session. Although Dr. Sampan Simpanat cannot join us today, but fortunately, he will be joining us virtually. So please welcome Dr. Sampan Simpanat to officially opening the session. Please welcome.
สวัสดีครับ Good afternoon everyone. Good afternoon from Thailand. I'm very pleased to be invited to do the opening remark for such a very challenging topic that we love to hear the input and insight from everyone who joining the meeting. Okay. I think everyone in the whole world today, when we wake up every morning, we heard the word AI almost every day. I think AI is one of the technology become a big breakthrough, become a big game changer for the whole world. Right now, during the past few years, I myself experienced by myself in my working place that we have been using AI to improve the big breakthrough in manufacturing and operation and the business. We can save hundreds of millions of dollars within a short period of time. We can make a quality better. We can make it leaner and faster. The product have been manufactured, in the faster way, predictable, very accurate in all the KPI that we have been measured on along for so many years. Now, we want to see where is the opportunity of AI that become in help in the trade and health sector. I think everyone have a dream that if one of the people in the Thai rural area have been sick, I hope AI can be the power diagnostic, can be predictive tool to help that the villager, one of the villager in Thailand, can reach seamlessly via the telemedicine to the specialists all over the world. I think that one can help, number one, can save our people life faster, can make it cheaper, and at the same time, everyone in the whole world can reach to the expertise from the technology. So I like to encourage everyone who have been invited to be the part of the panelists here, including the all attendants, try to work together, put everything in the collaborative, very deep collaboration format to make this happen. I think a lot of billions of people life are waiting for the technology become useful, become applicable, become that can make their life better and easier. I like to declare the opening of the session. Thank you to the whole team, and I will continue to enjoy to learn whatever the discussion today. Thank you.
Thank you very much, Dr. Sampan Simpanat, the chair of the National Commission on International Trade Studies, for his insightful, informative opening remarks. Before we now move to the first part of the discussion, may I please set the scene for you all for the discussion today. So the discussion today, we will have like 2 parts of the discussion. So the first part, we are going to discuss on how AI and data-driven healthcare under the aspect of international trade and health services. And the second part, we are going to explore more about the opportunities and challenges. And we will have a little bit short break out there. So please feel free to bring snacks around 3 p.m. and enjoy it and continues enjoying the discussion here. So let's move to the first part of the panel discussion. So to moderate this session, may I introduce the speakers and the moderator of this session. Please welcome Dr. Rupa Chanda, Director of Trade and Investment, UNSF Bangkok. Please welcome. And the second speakers, we have Dr. Piyalit Itichaywong, Head of Sirilat Kariwa Saiga Lab Sirilat Hospital and co-founder preceptor AI team at Kariwa, Thailand. Please welcome. And we have Professor Farah Makrabi, Professor from Australian Institute of Health Innovation, Macquarie University of Australia. Please welcome. And finally, we have Dr. Manisha Sherhar, Regional Advisor from the WHO Southeast Asia Regional Office, New Delhi, India. Please welcome. And I also would like to hand over this floor to Ms. Nanut Mathurapot, the Head of Global Collaboration Unit, National Health Commission Office. Please take this floor.
Good evening, good afternoon, everyone. I think these sessions have three key words. That one is about AI and technology innovation, international trade, and health services. And we have all panelists who have been working on these topics for many years. But Dr. Rupa and Dr. Manisha work on international trade and health services. Dr. Manisha working particularly on intellectual property rights, trade and health, or about regulations as well. But both of them know a little about AI. Why Dr. Piyalit and Dr. Farah, who's been specialized in AI in health services and all technologies, but know a little bit about about international trade. For me, I am very low technology, and also avoid seeing a doctor. Apart from that, I know nothing about international trade, only online shopping. So I feel like I am excited to moderate these sessions and also to ask questions to panelists as a consumer of AI and health services. So I hope that these sessions will be more interactive, that participants can help me ask the question that might be useful to all audiences as well. But may I start with Dr. Rupa or Rupa first, may I? Because I think right now, the trend of trade in health service is going high, but I would like to know what actually the trend currently. Can you give us a background on this issue as well as touch upon opportunities and challenges on this issue? Thank you.
Good afternoon, everybody, and also to those who are joining virtually. So as our moderator has said, we are covering this question in the title from different angles, and we're trying to complement each other's backgrounds and expertise. So I will be going first mainly to sort of contextualize this whole discussion and say, firstly, what is international trade and health services? Within that, the focus area was given as cross-border telemedicine. So what is that in terms of trade and health services? And within that, how are we looking at the opportunities created by AI and integrating them into health services trade more generally, as well as specifically cross-border telemedicine trade? So I'm going to stand. It's easier for me to see the slides and speak. No, I'm fine. Okay, so very quickly, I would first like to say, as I said, define what do we mean by health services and telemedicine trade. show the trends as the moderator, because it's important to recognize what are the growing opportunities and where are they coming from in terms of the modalities of trade and health services. Then where are the opportunity areas for AI? But of course, there are regulatory and many other sorts of challenges that are there, some of which are not specific to AI and some are more because of AI. And then what could we look at in terms of future collaboration? So just very quickly on defining health services trade firstly, there are different modes by which you can trade any service, and that also applies to healthcare. So you have cross-border, which is like the movement of the service itself across borders, and that's what we're going to focus on a bit more, which is telemedicine trade in this case. So you're doing diagnostics across countries, you're doing radiology imaging and sending over the report across countries and so on. Could be doing consultations, etc. And that you can imagine is growing because of the growing uptake of digital adoption across countries. Then there is the mode 2, which is the movement of consumers. And that's also very important in health services trade. It's about medical tourism, medical value travel, right? Then you have FDI. A lot of healthcare, health services, so hospitals, diagnostics, even telemedicine facilities are set up with foreign investment. So that's another way in which health services would be traded. And finally, the movement of professionals, care workers, etc. Now, important thing to recognize, even though in this session we are talking of cross-border telemedicine, actually these are complementary modes. And when we talk of AI's integration into health services, it's not just about telemedicine trade, it would be to support other modalities. And so one has to take a sort of integrated approach to health services trade, not just telemedicine trade per se and AI. So these are just some definitions. I'm sure I don't need to go into that for this audience. Now, quickly on the trends, as you can see, I mean, health services is not one of the most traded services in the world. I mean, if you look at it, tourism, financial, those are the areas which show the greatest amount of services trade, but it is a growing trend, and we all know why. Because of, in terms of shortages, demographics, the opportunities, people's affluence, there are lifestyle issues, and so on. So there are many factors behind this. But you can see the sort of growth that we've had over the last this is pre-COVID. COVID changes things a bit. But look at the 4 modes that I outlined earlier. It is primarily FDI in health services, actually, that is the driver of trade in health services. And that's important because actually FDI is going to create many of the opportunities for AI in healthcare because a lot of foreign investment and corporate investment is going into AI. So this is an important linkage to remember. Mode 1, which is a cross-border telemedicine part of it, is a very small segment, but it is the fastest growing segment, and post-COVID, it is the fastest. Mode 2 is, of course, medical value travel is very important too in trade and health services. So as I said, growth between 2010 and 22, but primarily driven between 2020 and 2022, post-COVID. COVID, as you know, if you just look at the numbers between in 2020 itself, because people couldn't move, professionals couldn't move, FDI also fell. So basically other modes fell in terms of their significance in trade and health services, but mode 1 has picked up. So there's been a natural secular trend in terms of the growth of mode 1, that is cross-border health services, but also because of the COVID shock and increased digital uptake, and the reliance on online has increased significantly. Just some statistics from the WTO, $4.8 billion. It's not a huge area. In fact, health services is one of the smallest in terms of cross-border services trade, but it has a lot of potential. And you have to put this in the larger context of national telehealth picking up. So that's the reason why, of course, once countries themselves become much more prepared, people become much more ready, that's what will give the offtake for trade in health services through mode 1. Okay, just some numbers, as I said, 2019 to 22 is when you see the sharp increase, 56% increase in just those COVID years in mode 1 based exports, and huge drop in mode 2, mode 4, which rely on people movement. And imports similarly have also increased. Again, cross-border trade and health services after the pandemic, you see the sharp sort of rise, the uptake. And this is just one specific country which is known for health services trade through mode 1, which is Singapore. Many of its hospitals do that. And you can see the declining trend when it comes to mode 2. and the increasing trend in terms of. So just to give a bit of context of how things are changing. Also important to note, because we are talking of the opportunities to integrate AI, we must know who are the players also in health services trade. And it is not that spread, because even though regionally, yes, EU is there, North America is there, Latin America and Caribbean, certain countries are there. Asia Pacific is an important player in this. But within these regions, you have only few countries participating. That's important to remember. So therefore, you're not going to see a huge offtake in terms of trade and health services through AI, because it ultimately comes back to the preparedness at the national level. What are the main drivers? Well, teleradiology, teleconsultations, these are some of the big revenue generators within Mode 1 and true for cross-border trade as well. The drivers, as we know, technology, enabling infrastructure, consumer uptake, shortages, and therefore need to replace with technology, and the development of telehealth regulations. So again, the regulatory capacity and preparedness, very important. But as I said, a lot of untapped potential. Just look at the small share of health services within total cross-border trade and services, just 0.14%. Health is among the lowest. I think it's probably the lowest. Okay, now coming to how do you integrate? What are some of the opportunity areas? I'm not a specialist in AI, but again, I don't look at it as health services trade per se. It's really opportunities to integrate AI into the delivery of healthcare within nations. That's what's going to give you the platform to do it cross-border. So the way one can understand it is there are three areas broadly where you can integrate the use of AI in the actual patient care and management, treatment, etc., and at various parts of that value chain. It could be in the overall healthcare administration, management, and so on at the organizational level. And then you can think of it in terms of wider health systems and programs and so on. And I would also put there the whole R&D ecosystem as well. Okay, so I've kind of tried to cluster the applications in three broad areas. And when we look at patient-oriented, just given some examples here, diagnostics is one of the areas where it keeps, there's a lot of literature, relatively more. I won't say there's a lot of literature on AI and healthcare services trade, but in diagnostics, there are examples of how, using AI, you can get much more specialized, much more accurate sort of radiological image analysis, diabetic retinopathy, and so on. There are examples given of that. So improved accuracy in detection. You can integrate the care from end to end, support them from the prevention stage, diagnostics, and the solutions and the treatment and the monitoring, etc. Patient management through the whole process. You can use a lot of the patient, the data, for instance, to enhance the sort of predictions and the analysis you do. You have a lot more data which you can use AI, and therefore you can do much more advanced sort of data analysis and the sort of treatment that would be required. You can do hospitals at home. So again, this end-to-end thing becomes very important. The wearable devices which integrate AI. At the organizational level, again, in terms of, I'm sure other speakers will talk about it, how you use the data, the platforms that you have in terms of your workflow management, the resource allocation on insurance and risk analytics. And in the R&D, of course, we know about drug discovery, etc. Now, these are not always per se health services trade specific, but they all support health services in general, the delivery of it, and then, of course, trade as well. So I found this perhaps, captures what I've been trying to say across the various facets where you can apply AI in healthcare delivery. This is from a WHO publication. So in the prevention part, surveillance, screening, diagnostics, healthcare delivery, what I was mentioning, allocation of your management, your workflow, etc., treatment, and then follow-up, and drug discovery, development, the R&D part of it. Obviously, if you look at it in terms of implications, more precise outcomes, safety, reliability, accuracy, tracking, lower costs, efficiency, you can name all of those. There are, of course, risks as well, which on the regulatory side in particular. And then if you look at some of the evidence that is coming out, it's like more patient-focused treatment. You can focus on the critical care. You can provide much more advanced solutions. You have more evidence-based sort of knowledge and skills, etc. Now, none of this that I'm saying is specific, again, to trade. It's, again, about, what you do domestically, and these outcomes would be relevant in the health services trade context as well. But why is it important? Because obviously it's going to have implications for your competitiveness. It's going to allow you to provide more advanced solutions, more better analysis, diagnostics, etc. If you, of course, are prepared in terms of the infrastructure and the specialists, etc. The other thing I wanted to mention is it's not just about mode one, it's about the implications for other modes of health services trade. And the way I see it is that you're actually going to see a much more synergistic role across the modes in future once you integrate AI. For instance, if you look at medical tourism, the development of AI can also actually help in terms of attracting prospective medical tourists. So provider and tourists, they can actually use a lot of the data, the promotion, etc. You can have chatbots, you can have, platforms and so on. So AI can actually enable the other modes of services trade. It can support the delivery of services trade through all the modes. And as I mentioned earlier about corporate investments and so on in healthcare startups, medical devices, technologies. Challenges and concerns, again, not only specific to AI, largely even cross-border telemedicine trade, I could say, is constrained by one, the digital infrastructure and the readiness, the regulatory capacity and whether regulations are in place, the skills, the innovation ecosystem, and cultural and social norms also play an important role. So on the legal and regulatory side, data, of course, immediately comes to mind when we talk of AI, data privacy, ethical use of data, the representativeness of the data that you use for the analysis, etc. But there are other regulatory concerns also, which are not just about AI, as I said. It's about licensing, accreditation, recognition of qualifications. There are liability and malpractice issues. If you're going to be providing cross-border telemedicine, and now you bring in AI on top of it, it's jurisdiction, and if something goes wrong, patient safety, where are you going to try it, in whose jurisdiction? Technological issues are also very important. You're talking about data movement, but you have data platforms and formats. So are they interoperable? For instance, infrastructure is of course a basic one. Again, anything in health services trade, financial and payment, cross-border payments issues are important. Cultural and linguistic issues. So again, AI can address that, but it can also aggravate divides. Digital readiness and skills, again, do you have the manpower to actually start doing cross-border telemedicine, let alone then bring in AI into that? Trust and acceptance is extremely important, both on the part of consumers as well as healthcare providers. This is just a very interesting survey that was done. So there is something called the Services Trade Restrictiveness Index. For different services, you capture how restrictive, how open or restrictive is that particular sector to trade, and they do it by modes. So there's a survey that's carried out periodically. The World Bank and WTO do it. And if you look at the sort of conditions that could apply to cross-border telemedicine, firstly, do you allow cross-border delivery at all? Do you require the establishment to be there in your country before you can actually provide? Because you may want within your jurisdiction, you may want some sort of entity to be there because you don't want the data to be moving across countries. Do you have data privacy restrictions? Do you limit the scope of the data that is transferred? Do you require local data storage, and so on? So these are standard sort of, they apply to many other services trade, also finance, for instance. But so what this is showing, basically, it's data related regulations that are the most constraining when it comes to cross-border telemedicine. And obviously, then you bring in AI into that, it will add on more layers of constraints. And there's a lot of regulatory fragmentation. This is the other point to highlight on data. So different countries, in fact, at ESCAP, we've been looking at digital trade related regulations. And within Asia Pacific in particular, you find countries going in different directions. So there's tremendous need for harmonization. So as I mentioned, legal considerations, data privacy, recognition, medical liability issues, and so on. And again, given the integrated nature of modes, its restrictions in other modes can also impact upon cross-border telemedicine. When you bring in integration of AI into health services, it does aggravate some of these challenges, could bring in more concerns. For instance, because you're resting a lot of the analysis on data, one is the ethical use and access of it, but also when you're doing the analytics, how representative is the data? Is it biased in terms of ethnicity, race, gender, etc.? interoperability. And a very important thing in anything using digital is whether it actually leads to more sort of asymmetries in terms of the digital divide, standards, and so on. So this is where, if countries are at very different levels, their ability to participate in this kind of trade will be very limited. Okay, so this brings me finally just to some quick thoughts on what we need going forward. I think there's a lot of scope, not just to cooperate when it comes to AI and digital governance and regulations, but more broadly. And there are forums multilaterally as well. You do have the WTO trading services negotiations. You have other platforms. So there is a lot of need to exchange information, good practices, how AI and other digital sort of policies are developing. You do need more discussions when it comes to domestic regulations and the WTO does have such a platform. You need discussions on professional services and recognition and standards related issues. And if things progress in the WTO, you will need further liberalization when it comes to cross-border telemedicine, because today there are lots of conditions restricting that. And at the regional and sub-regional level, I mean, at least in Asia Pacific, one can say there is a need to look at different regulatory practices and try and align to international standards. Digital trade and AI-related regulations, there are some good examples actually which are coming up in terms of trying to harmonize. So you have digital economy partnership agreements, the framework agreement on digital economy in ASEAN, for instance, and there are other examples, APEC, the African Continental Free Trade Area, which are starting to look at these regulations and in the context of healthcare, not just generally. So as I said, I would like to just end by saying that ultimately it's about domestic preparedness. That's key for telemedicine trade and any integration of AI in such trade. Who will participate? Those who are ready in terms of the investment in financial, human, infrastructural, institutional, and regulatory capacity. All this is really needed, and regulatory fragmentation has to be reduced if you want to promote AI-enabled health services trade. So I'll end with that. Thank you very much.
Thank you, Rupa, because this is such a small room and like participants. Actually, I plan to have 2 panelists and open the floor. But if you have any question related to Rupa, would you like to ask first or keep it later? Right. So otherwise, because Rupa have mentioned about opportunities and challenges, and even 5 challenges that we need to concern, especially on regulations. I understand that there are many already regulations exist, but it is divergent. National level as well as global level might be not related. And even some issues have no guideline, no framework. So I would like to ask Manisha to, could you shed the light on like regulations, guidance framework related to AI in health services, AI in trade, especially whether WHO have recommendations on these related things, please.
Thank you, Nanut, for that introductory remarks. And I have to also thank the IPH team for inviting us for this very interesting topic. In fact, just before we walked in, Rupa and I were sitting and I was telling her, I said, my work in terms of intellectual property rights and trade is a little bit like salt and pepper, because it's an ingredient in so many different areas, and I have to understand that area to be able to see what exactly it is. And this has given me an opportunity also to go back to some of the work when digital health was being decided and discussed in WHO. So I would just like to cover, as Nanut mentioned, what exactly is happening in WHO, and then we can have more discussions on this as we go along. So while we talk about WHO, I thought you would like to know that everything on AI is like work in progress across the international level and also at national levels. So we have the UN General Assembly resolution, and I've just highlighted it so that you all have it with you. And if you read this resolution, it was passed in March 2024. It actually was introduced by the US ambassador. And I thought, in the light of the current day political situation, I must put this up. And what they said was that we need to make sure that to govern this technology rather than let it govern us. And I think this was very well said when they framed this resolution, and it's worth reading. And they also now have an advisory, there was a high-level advisory body on AI, and they have also released their report in September. And this is important because it sets the framework at a larger global level as to how we hope to see AI serve to govern the technology for everyone's good. And this is very important. On the right side, I have this picture of the UN activities on artificial intelligence, and this report has contributed a lot to development of this 24 UN resolution. This was a UN, the International Telecommunications Union. They held a meeting and a set of deliberations in which I have put it in the bottom, where there were about 40 UN bodies that came forward, and they put in their, their concepts and what they think that AI can do for. And it is, I put it in parentheses, artificial intelligence for good platform launch of International Telecommunications Union AI, etc. It's a huge event that they did, and got a lot of people to comment on it, and it has led the basis for further discussions as everyone moved forward. And it was in 2021 that the WHO also started with their discussions. And in fact, I was invited in headquarters for this, before this discussion, when the digital health strategy was just began. And the reason was that when the team was looking at how exactly intellectual property rights and data protection and data privacy, because patients' data is going to be maintained in these records, and then how that will be seen in AI related applications. So that was the discussion which took place when I joined. Pursuant to that, I have not really followed much on this, but this has been an opportunity, in fact, to get together everything. But interestingly, the WHO's global strategy on digital health is 20. This is the pointer. Yeah. This moves. So there is this WHO Global Strategy on Digital Health. And as you can see, it is a 2020 strategy. And it says digital health expands the concept of e-health. And I have another slides because there are so many of these terms that we use. I thought it would be useful to take it from this global strategy and see what exactly was decided at that level. It also talks about in all kinds of using all digital technologies for health, such as Internet of Things, advanced computing, big data analysis, and artificial intelligence. I just put that in red because that is the focus of our current discussions. And what is important is that the WHO's global digital strategy is very clear in terms of, they talk about classified sensitive personal data require high safety and security standards. This is something very important, not only for patient safety, but there is a danger of it being misused by insurance companies. And therefore, we have to make sure that this happens when we look at AI. And they have stressed for a strong legal and regulatory base to protect privacy, confidentiality, integrity, etc. It's all around data, that how exactly is this data mining that is being done by these applications, how is it that we can make sure that they meet these standards? And then good quality data needs to be collected, because if the data that feeds in is not of the right quality, we will not get the right information. And Rupa just mentioned bias. So it is important to make sure that everybody is represented when a certain particular data is collected. And this becomes very important when we are going to look at using AI for policy decisions, because we have to make sure that the policy is taken up in the right order. And then transparency and efficacy, effective communication about data becomes very important. This I just put up for the sake of clarity from the global strategy, and I thought this would be very useful for all of us, because artificial intelligence, they talk about emphasizing the simulation of human intelligence processes by machines that work and act like human beings. And this was actually first used in the word artificial intelligence was to make intelligence, machines work intelligently. I think it was it was in Dartmouth, John McCarthy in 1956 or 58, around that time, that he had used the word for the first time, and which has become so much in vogue. Then we talk about big data, and big data is this huge complex data that for which we need large storage. And the unique properties of big data are defined by these 4 dimensions: volume, velocity, variety, and veracity. And this is in the global strategy. I've just taken out the points that matter and are important for our discussions today. And blockchain is a digital database containing information such as records of financial transactions that can be simultaneously used and shared. And that is critical when we look at blockchain. And for digital health is expanding the scope and the concept of e-health to include digital consumers with a wide range of smart devices. Because when we looked at e-health, it just looked at e-health. When you talk about digital health, you have your smartphones, and everybody becomes a consumer for digital health. And e-health is there. And then we have the Internet of Things, which is interrelated computing devices. So this is a good way to begin, because these words are being used interchangeably. And when we are looking at policy, it is very important, and regulation, that we get the concepts clear so that we can move forward. My presentation now covers these the 6 documents over here. The last one on this is a course on ethics and governance of artificial intelligence for health. But you have these on the WHO website. And during the discussions, when I was invited also for data privacy, the scope of these documents was actually laid out. And it was pointed out that AI will not work as a separate unit. It has to be integrated to each and every disease program. And how AI will affect each and every disease program will have implications in terms of the trade and health aspects with respect to that program. And also the intellectual property rights issues that govern that particular program. And therefore, what I have done is, for the benefit of our discussions, I've just taken the top 2 or 3 points from the 6 documents to give you a flavor of what has been discussed and decided in WHO. And then you can obviously go back to those documents and see, but these documents are being used to develop strategies at national level. So for example, I know for certain that in India, when they developed the strategy, they went back to some of these, the National Strategy for Health, they used it. And I'm sure we'll have that experience from Thailand when you take up the discussions as well. So the first document is the Ethics and Governance of AI for Health, and there's an executive summary in 21. And this actually refers to the ability, AI actually is the ability of algorithms encoded in technology. That technology itself learns from the data, and they can automate the processes. So this is how they have defined it. And they also mentioned that it can augment the ability for healthcare providers to improve patient cares, diagnosis, the whole of the diagnostics process, including optimizing treatment plans, pandemic preparedness. This is very important. And I think one of the strengths of AI could be to use it for this kind of predictive use on what events might happen, and then have time to analyze them so that we are well prepared before we have any other event in public health. And then, of course, to inform decisions of health policy makers. These are the 6 principles that they have outlined, and these 6 principles are actually embedded in all the subsequent documents that have been covered in WHO when they have looked at the regulatory interface with respect to AI. So protecting human autonomy, human well-being and safety, transparency, intelligibility, that is very critical in terms of AI. Then they also talk about responsibility and accountability, inclusiveness, and then promoting AI that is responsive and sustainable. So these are some of the aspects which came up in this document. And this, because a lot of work is being happening on medical devices, and this is generating evidence for AI-based medical devices. And it's actually, the short form is SAMD, and I just brought it up together to say that AI, it is artificial intelligence-based software as a medical device. And this is finding numerous applications now, particularly because of the advantage of precision that the AI brings. And AI is being embedded in a lot of devices to make sure that it's more and more automated. In fact, one of the very interesting patents that has been filed also on this, and which is also debatable, is they are saying that, do you need a pilot to run an aeroplane? So nowhere it says that a pilot has to be a human being. And, you know, we have drones, but even a drone is controlled by a machine in the hand of a man, or somebody is controlling it. But the patent which is filed is that there will be an AI-based machine, which will take decisions on its own and will be in the cockpit. Because it says there is a discussion that we don't need to, nowhere it says that a pilot has to be human. What I'm only stressing is that the kind of technologies that are where AI is coming is very unique. And anybody, I mean, I don't know whether if I'm flying, I will be feeling very safe to be driven by an AI piloted engine. But and for safety and health, it is, and health is equally important when you're taking decisions. So we need to look at patient care and others, and the application of AI has to be in a particular context. So on the right side, I have just put the algorithms for the AI, and they, you know, we have the clinical trials, the 4 phases of the clinical trials. We are very familiar with drug trials. And here, these are the feasibility, capability, effectiveness, and durability. I have taken it from the document, and you can read this. This is a very interesting way they have looked at what is happening in terms of devices. And these are some of the examples: computer vision applied to visual inspection with acetic acid, potential to act as a clinical decision support and improve visual interpretation. It provide, and also to provide an accurate, almost instantaneous prediction of high-risk precancerous lesions. So these are some of the things that these devices are being used for. So can we go to the next slide? Yeah, this is 4. So these are some of, there is this other next document on the regulatory considerations on AI for health. And I believe, Rupa, you took your slide from here. And this is a very comprehensive document. This talks about, so what WHO has done is the first bullet in blue is important, because they have set up an international, with WHO and the ITH, there is a focus group on AI for health. And that is an acronym. And this is a group that is meeting periodically to look at all the regulatory aspects and what are the areas where AI is going to impact at the national level and also across international borders as products move across in trade, and what could be the implications of this. And this is a regular work being done in WHO. Incidentally, I haven't put it over here, but we had because it was not directly related and the document is yet to be uploaded. There was a conference on traditional medicine last September in India, which was led by the WHO, because there is a global center on traditional medicine. And there they looked at what are the implications on traditional medicine and AI and regulatory, including trade. And in trade, one of the important parts which was discussed there was, how do you name the traditional medicine product in a way that it moves with the same a nomenclature across different countries. So there are issues on that, but that document has not been uploaded on the site. So while I can share, this is some of the discussion that is had, I didn't want to mention it in detail. But there are discussions happening across different, every sector, in fact, given the importance of the AI. So there are these key recommendations on the regulatory aspect, 1 to 6, and each one of them are equally relevant outside of AI. But in terms of AI, we have to give it a greater focus because of the very speed and the agility of the tool that we have in AI as we move forward. I also would like to emphasize that apart from WHO, all these other international regional organizations directly involved in healthcare, which is at the second bullet. So you have the IMDRF, which is very engaged with it, especially because medical devices is such an important area. And then there is the Global Harmonization Working Party. They're looking at regulations all across the AI and or the devices. And then the International Coalition of Medicine Regulatory Authorities, they're looking at it. The ISO, the Standardization Authority, this is very important and has great implications for trade because when you have ISO certification, these devices have to be accepted across all the international boundaries when ISO certification is done. So there is a lot of work happening there. And of course, the ICH in terms of pharmaceuticals for human use. So this is the third one. And the fourth document is with respect to ethics and governance of AI for health. And they talk about the large multimodal models. And this large multimodal models is exactly what our ChatGPT is. And this is where that really feeds in. And this is a generative AI that is, it is even within the AI, it is further a category in which algorithms are trained on data sets. So the data set could be text, images, or video, and that's where this comes in. And more importantly, it is generating outputs that are not limited to the type of data that is fed into the algorithm. And that is very critical because what you feed in is not necessarily what you get out. But then these models have to be taught. In fact, just when I was coming here, just 2-3 days back, I think there was a news that the OpenAI gentleman, who was it, Sam Altman, he has tried to move out of Microsoft because Microsoft is not able to provide those large I mean, to the extent that it is large platforms are needed for the generating those learning platforms, teaching the ChatGPT to respond to each of those queries. And it is taking a lot of data and a lot of computing power. So these are some of in fact, those are some of the challenges. And while the people are looking at those challenges, there are also intellectual property rights embedded as these AI algorithms are created. Who owns the algorithm when it is created? In fact, the other day there was, I think it's in UK, they are trying to relook at their act for copyright. Copyrights is another part of intellectual property. And I think it was Elton John and Paul McCartney who are saying that, they are saying that you can remove that any music which is in public domain could be used by these platforms to generate their own content. But then who is the owner of it? And then another point which is under consideration is that the author to the music can say that they will opt out from the AI using it. It's a double-edged sword for some of the celebrities because you have to be on the internet to be known. And then you have to opt out of the internet because your intellectual property rights is going to be affected and nobody is going to pay you. So where will the artist earn its money if nobody is going to buy their album? So there are a lot of issues which are under discussion, not only on the intellectual property rights with respect to their trademark and patents, which are very focused on medicine and health, but also with respect to copyrights and performing rights where these aspects are under consideration. So these ethics and governance aspects for AI are equally important. And I mentioned the ChatGPT. the use these are actually called because they are large multimodal models, and this is their use in terms of diagnostic, clinical care, and patient-guided use. We have to generate information to improve understanding, but then the understanding should be such that is absolutely useful to the patient. But for clerical and administrative tasks, I think this is my view, and I think Dr. Sampan also mentioned in the beginning. I think this is best suited for that because you save a lot of time, and it's just a repetitive clerical task. And I think this is where AI can be very useful. And we also hope there won't be many ethical issues around that. And then for medical and nursing education, and the main risk, of course, it is being used for scientific research and drug development. A lot of work is being done for new drug discovery by using AI models in order to shorten the first phase and the second phase of the clinical trials. So this is another area of work. But the main risk is inaccurate or incomplete or false responses, and we need to have a look at that. How much time do I have, Nanu? Just tell me, flag if I'm good. Okay. So the fifth one is on the benefits and risks of using AI for pharmaceutical development and delivery. And in this, each step of the development of medicines is being influenced by AI. In fact, it is very interesting if you look at some of the pharmaceutical enterprises. In actual practice, they are competitors. But for bringing these AI models, some of them are also collaborating. So it is leading to a very meshed way of working, even when you look at how enterprises need to collaborate to be able to take out the maximum information and share knowledge for AI. And so this is some of the work that is happening. Several types of IP rights, including trade secrets, copyrights, database rights may apply. And then so I have mentioned that they are collaborating. The uses of AI in pharmaceutical development is for basic research, then discovery and design, the preclinical studies, and also for clinical studies and regulatory approval. And in this, there is a need for collaboration across borders, because clinical trials are also, when we look a little deeper, they are also, some of them are related to genetic dispositions of populations. So when we decide something in one country and the product has to go to another country, how it will impact on that, these things are becoming very important because medicine is also becoming more precision-based. And so some of these aspects need to be dealt with in detail. This is another document which, as I mentioned in the beginning, that the discussion in WHO was that each aspect of AI must relate to the disease program. And this is for the role of AI in sexual and reproductive health and rights. This is a March 2024 document. As you can see, it's all work in progress. We are all working towards it. And these are the aspects that they have said are very important. I've just taken out the main points. It's a big document. Health information, education, and promotion, AI can be leveraged for that. And also for the creation of chat box for health information. And sometimes people may find it more at ease to be able to talk to a chat box for some of these aspects rather than interacting with a human person. So this is some of the aspects where it has it will find use. But in that case, one would have to see the cultural boundaries and how things are being communicated rather than have a one-size-fit-all chat box kind of communication. So these are some of the challenges here. Screening and diagnosis is another aspect. Then treatment and care management, personal health monitoring. These are also applicable across the board on health. Understanding health trends, health system management, and the clinical research and drug discovery, which is across, as I said, drug discovery, but more particularly they have mentioned for algorithm models in terms of resistance for HIV, because that has been in the focus for very long. I just to emphasize that I took out some the US and EU, what they are doing. And as you can see, it is again work in progress over here, and they have an executive order, which was passed, of course, by Biden. And under this order, that is the primary focus, which they have said, to develop guidance, regulations, and other tools and to guide for digital health tools, etc. So that is the first bullet. And this, the task force was to give its report in 28 January 2025. I put it in red because I don't know whether that report is going to come, but I thought we need to highlight it because this could be a very important report. It has to develop a plan on responsible use and deployment of AI tools in healthcare. So this is a lot of work that has been going on. And if you look at this bullet by January 12, 24, I was able to get this information. I was looking at the last information. So you look, there are 690 AI-enabled medical devices that have been approved by the FDA. In fact, I was trying to look at what are the different disease domains where they are there and what is their use. So I was still looking at this information. But what is important to see is that even though there is work in progress in terms of the US FDA, the devices are actually being approved. So it's going hand in hand. It's not as if we are first developing the policy document and then giving the approval. So the approvals are taking place simultaneously, and this we need to understand because this is how perhaps we can also know how the AI is performing in these devices and improve our regulatory preparedness and our regulatory response as we develop these policy documents. So I also thought that when we do the talk about, this is what is happening in the European Union. And this is, they have an act, and the act is the first ever comprehensive legal framework, they say. This is as per the website. They talk about minimal risk. And this is very important, particularly they talk about AI-enabled video games. This is becoming important because of the discussions on mental health and the implications that some of these chat box related algorithms, they pull people to continuously sit and be engaged with them. So, and it is leading to problems with adolescent children. So I think it was in Australia that they have banned AI or chat boxes or something in school. So there are countries which are taking action on this regard. And then there is they talk about a specific transparency risk that inform the users that they are interacting with a machine. This is very important, and this has legal aspects across European Union, but I think this is something that would eventually be extended across all jurisdictions in the world, because one has to know it's not a human being, but so that the response is very clear. And then it's a high risk, and then they talk about an unacceptable risk, for example, AI systems that allow social scoring by governments and companies. It should not be used by governments and companies to segregate people and promote discrimination. So these are some of the aspects the legal must be brought on mind. They have talked about a strong regulatory framework based on human rights and whatever can be done for better healthcare, safer and cleaner transport, improving public services for citizens. So these are some of the aspects that they have discussed. And they are also continuously engaged in this aspect. So thank you for this opportunity, Manut. Thanks.
Thank you, because actually there are framework or UN regulations, WHO guidances for 6 guidances. USA and EU already have regulation and even act in EU, but it seems like advancement of technology go very fast, but laws, regulation, guidance try to catch up with the advancement. But because this is quite small room, so I would like to know the participants more. Any one of you work on AI particularly? No. Anyone work on health services particularly, or health in? No? Trade? No? So why are you interested in joining these sessions then? Can I ask the one next to me?
Actually, I come from School of Global Health, Faculty of Medicine, Chulalongkorn University. I come here because I'm the beginner for this topic. I'm the medical educator and the researcher, but I don't provide any health service to the others. But AI is raising topic now, so I would like to know how to integrate the AI with the education and also some health promotion. Yeah, so that is my concern, and then I come here.
Because right now AI is like a part of our life actually, and I see you looking next to me. Can you give the microphone stuff?
Hi, I am from Mongolia. I'm UNICEF country office. I'm digital health officer. I just interested here because still the AI is the new topic for us, and Mongolia also starting to talking about this one especially in digital health and health services as well. So I want to catch up some information from this session. Thank you. It was very useful.
Right. I think AI is AI in health services is it's already come to our life, but international trade make it more faster to come to our life. The first two panelists has mentioned about more like global and regional level, the situation and trends, opportunities and challenges. But I would like to learn more about at the national level, the situation in at least we have two panelists, one from Thailand and one from Australia. I would like to know how these two countries respond to AI in health services or AI in international trade. May I start with Dr. Piyalit? But apart from talking about national situation on AI related, because I know that you are AI geek, and which is very interesting because like doctor and working on AI as well. Can you give me any example about AI, which is not like we already know ChatGPT, but is there any application that make people hear wow? Okay. And then you can mention about what how Thailand in your perspective respond to AI services.
Okay, sure.
Please.
Okay, thank you. Hello. Good afternoon, everyone. In fact, I'm from London. Yeah, so but now I think it's around 7 a.m. at London, so I'm feel really tired. I'm sorry if I speak something that is not clear. Can I change to my slide, please? Okay. Yeah. Okay. I think I want to start. In fact, for today, in fact, for the medical AI, I think both of the speaker talk very much in detail, like in the medical AI in the past. What I want to divide AI into the two patterns. For the conventional AI, like the AI in X-ray, AI in the ultrasound. I think many of you know about that. And can I have a okay? Yeah. And the second thing that I think is very popular nowadays is the generative AI, but it's popular and also used in many industries like the finance or the commercial or the other industry. Yeah, but for the medical AI, if we want to use the generative AI in medicine, we need to really careful about that. That I will talk in detail later. Okay, first I want to talk about this figure. It comes from the paper from the Google that you can see. In fact, this figure show that when we ask the AI to do the MedQA exam, MedQA exam is like the USMLE, the exam that we need to do to apply for the US residency at US, and I think it's quite hard compared to the other exam. Yeah, but you can see like the 2 years ago, March 2022. At that time, BioLinkBird get the score around the 45.1. At that time, it's a breakthrough. The breakthrough that, the AI, NLP AI can do the exam nearly pass for the USMLE. Yet, but you can see that for now, just 2 years later, MedGemini got the score 91.1. That is quite very, very good because the 91.1 for the MedQA or the user mind. It's like the 99.9 percentile medical student. So I think it's really good. And that time, I think many computer guy, my friends say, oh, now we can replace doctor with the AI. Yeah, but in fact, I also work part-time at the OpenAI as the lead team. That is my paper that I joined. I think many of you may try the GPT-4o, right? And what I want to say that for the GPT-4o is not good enough to use in the clinical practice. For example, if you ask like the how to test COVID in Thailand, you say that it in Thailand, but it will talk like the expert, but give you the recommendation from the US. So I think, sometimes if you don't expert, you will not know that the AI do the things called the hallucination that give you the long information, but with very, very high confidential. Yeah, so with that, the problem is, for the GPT-4 or this paper, I think allowed the August, August last year. Yeah, but the thing was changed because, in fact, you may know about the model that's called the O1 or the O3 by the OpenAI or the Gemini 2. That is called the listening model. The listening model means that normally for the large language model, it's mostly recognize all things in the world and answer you. Yeah, so it can only just remember and answer. So it cannot listening. Yeah, but for the O1 model or the Gemini 2, it can listening. How we know it listening first? It can do the exam like the IMO. That is a hardest exam for the mathematics in the world, and it got the gold medal list for the Math Olympiad. So and also the physics and so also the chemistry. So it's quite really good in the mathematics test. And for the okay. There's no laser, okay, but you can see that for now. You can see for the O1 preview, it's just a preview version. It got the score 96%. That I think it's like the maximum score that anyone can do for the user mind. And not only about the English. This one is user mind, but you can see JMLE, that is for the Japanese. For the Japanese, it's got the 99.6 percentile, 99.6%, not percentile. So I think it's it's the maximum score that we can get. So with this listening model, it's really good to use. And in fact, our team at the Thailand, we also work research. Okay, in fact, now I am the PhD candidate at the King College London. We also have the research between the King College and the Sira Hospital that I am working here. And now we test the listening model with the real use case, not only the multiple choice question. Yeah, but like the differential diagnosis test, and also like the ask about the, okay, if you have the clinical scenario, what's the investigation you want to send? And surprisingly, maybe not surprise for other, but first it surpassed medical student. Yeah, that makes sense. Second, it surpassed the medical residency for the internal medicine. And finally, I think it's the not significantly different from the specialist. Like the internal med doctor. So I think it's very good. And we evaluate in the how to say in the free tech, not the choice. Yeah, so I think it's quite good. And I think it helped the country like the our country that we have a very small number of the doctor. So it can empower doctor to do many things. Yeah, but the problem about the large language model is this one. Okay, if we want to deploy large language model, first, we need to think like the large language model is the medical device or not. And exactly, because it need to perform an action on the medical data. So it is the medical device. Yeah, but another definition of the medical device, for the all device in the world, if you push the input like the X, for example, ask about the how to teach COVID. But for the large language model, if you ask how to teach COVID for 5 times, it will give you different answer for 5 times. So the medical device that answer each time differently, it not accept now. So I think at least for the, as I know, for the US FDA and the MHRA at the UK, there is no company that have the approval of the generative AI in medicine. Yeah, so I think so we may need to wait a little bit longer so to use the generative AI in healthcare. Yeah, but for the Thailand, I mean, for my team, yeah, we know that we can use with the clinical practice directly. Yeah, but we think that for the medical education or for the health literacy, I think we can use that. So our team at in our hospital, and we also collaborate with the private company like the Kaliwa Thailand from the PTT that help us to develop the AI for T1. In fact, they are allowed the 20 AI at the faculty of medicine hospital, but today I would like to talk only the 3 that we deploy and have the evidence to support the efficacy. First, I want to talk about preceptor AI that we use the large language model that we fine-tune on the Thai data to help in the medical education. I mean that we help the medical student, nurse student, and the pharmacy student to learn more, to help them like give the exam and so that they can lead how to think about that. Yeah, with the listening model. And the second one is the Kindi in English is the good eat. I mean that it is an AI that you can take a photo like about food or the beverage, and it will say like how much calorie, how much protein by the retrieved by the database that now we have user around 190,000 people, and it's used, in fact, yeah, it a 3 million usage for the Thai people. Yeah, and the last one, more SR is the AI that can transcribe your text that I will talk later. First, in fact, I want to talk about the first one, about the AI that we deploy. You can see this one, and yeah, in fact, it is a Thai and English, and I think everyone will think like it's very painful to read the handwriting like this, and this one is my handwriting. Yeah, and normally nurse and pharmacist normally ask me like oh, doctor, what you like here? Yeah, so I understand, but I cannot do better than this. Yeah, but my idea is like, in fact, nowadays there are many AI, and the AI to transcribe our sound into the text. I think it is very advanced now. But the problem, for example, but the problem like the Google Voice or the Google Keyboard, that I think most of you may try it. For example, if I speak like the pneumonia, I mean it is a English in Thai accent, the Google keyboard we don't know what I say. Yeah, but so we need to fine tune our Thai English accent into the AI so that we can have the better performance. And this one is that we deploy in around the 12 hospital in Thailand that we use AI like this one. For example, this one is in my friend, and he talked with the patient. Normally in Thailand, most of the doctor will look at the monitor, not the patient, because we have like the 3 minutes per patient to treat. So most of the time, I think we need to type in the medical record, because if we talk the patient and we don't do medical record, we cannot normally we have like the 50 to 60 patients or sometimes the 100 patients. So if we don't do that, we cannot finish our day before the 6 p.m. So after we deploy this AI, everyone happy, because it changed from normally they look into the monitor and type the medical record, but it changed to they have more time to look into the patient and talk like the human to human. And after he talked to the patient and the patient come out, the AI will generate the summarization of the his talk with the patient. Yeah, so and yeah, that now we deploy at the 12 hospital. That this one is not about the automatic speech recognition here, but we need to combine with the large language model so that it not like the transcribe every word that you talk with patient, but it's summarized. Yeah. So, but okay, finally, as you know, large language model not a 100% correct. Finally, we need to adjust some, but it helped them significantly compared to before we have this one. And not only that, because in fact, in the first phase, we talk with our customer. I mean, my friend who are doctor, they say that they just want someone to take note for them. But finally, when they try it, they want more. But they want, okay, if I talk with the patient and I want to consult with the cardiologist, please make the consultation note for me, something like that. So finally, now we have many functions like after you talk with the patient, and it can generate the clinical note, it can generate the patient note to give back to recommend about the health literacy. And the next one is about the AI. Okay, the last one is the audio, and then the next one is about the image. And this one is the on the 2019 that my hospital collaborate with a startup called the Percepta, and we make the AI X-ray that is deployed around the 100 hospital now in Thailand. Yeah, but this one, in fact, is good for the junior doctor. Yeah, but when we talk with the radiologist, they say that it's useless. Yeah, many radiologists say like that because they say that they are radiologists, so when they see, normally they will outperform the AI. Yeah, that I agree with them. Yeah, but nowadays we change from the 5 years ago and we make the new AI. The new AI that you just give the X-ray, and it not only have the color like this and say that it have some abnormality, but our current version of the AI, we can generate the report for radiologists. Yeah, for this form of the AI, radiologists really love this because they don't have to type all things and they just edit some part of it. And in fact, this AI developed by our hospital, and we got the 4th ranking in the top AI conference in the world called the ACL, that we got the 4th ranking. And yeah, we outperform like the Carnegie Mellon or the other university in the world. Yet, but we cannot win the Microsoft. Yet, but the one thing that we win Microsoft is we use the model size smaller than Microsoft for the 4th time. Yes, so this model can run at the Sila Hospital. We don't need to use like the cluster of the CPU GPU to run. Okay, and the next one, next one is a Kindi that I say to you. Now we have the 3 million usage for the Thai people, and we start with the Thai language, but yeah, we also talk with the Lao people. I mean, Lao, Cambodia, and Myanmar. They want their language that we plan to expand later. Yeah, but what our AI do? Our AI is we want, normally after I talk with the patient, like when I in the NCD clinic, I will have only the 3 minutes. So I have no time to tell them that like the green tea have the high energy, green tea had the high sugar. And in fact, one time that I treat with the patient, they say like they consume every medication that I give that patient regularly, but the her sugar is still high. I don't know why, but finally I see she had the green tea, like the green tea very big big one, and I asked, oh, why you drink the green tea? Because the green tea had very high sugar. Patient tell me that, oh, you did not told me that green tea have very high energy. Yeah, so I think, oh, that inspired me to make the AI that you just take the photo, like this one is called a pad siu noodle, and then it will tell it's around the 480 kilocalorie, like that. And in fact, this our AI, we also benchmark with the Gemini 1.5 GPT-4o, and we win all with the model size only just the 3 million parameter. Yeah, so I think this one is very good because when you have model very small like the 3 billion parameter, you can just use only the small size of model. Yeah, and this one that we do now. And in fact, we are developing the open source model that we plan to release like in the 3rd quarter of the year. So that the people in ASEAN can utilize our model. And the second, this one is the computer vision, right? But for the last one is the tech model. In fact, our team I also developed our large language model that fine-tune specific in the medical setting. that in fact but in short you can see that in the below of the image that we won in the many competition by the Facebook, by the OpenAI and many things here. But this AI we want to help junior doctor to give the differential diagnosis that can help the patient. And our model also benchmark with the GPT-4o, and we get the better result compared to the GPT-4o. But unfortunately, for the new model of the OpenAI, I mean the O1 and also the Gemini 2 is outperform our model. Yeah, but we plan to improve our model. But this model, we got the ISO 13485 and also the IEC 62304. That is the standard for the medical device. Okay. Yeah, and in fact, why we do that AI, we don't just that help the medical student to do the exam or the other thing, but what we deploy with the more prom platform that have allowed the, I think 10 million user. We plan to normally in Thailand we will have problem about like the patient thinks that symptom is emergency. Yet, but for the health profession they think it not emergency. So many times we have the conflict at the emergency room. Yes, so our AI plan to like okay, AI will give the differential diagnosis and like have the support. Like if the patient see that okay, the AI say they are the green color, normally I think they will not come to hospital yet. But if it like the yellow or the orange or the red, I think it will accelerate the process that the hospital can let them into the emergency room and provide the faster response. And this one, we are the pilot at the Panangaya Hospital. Okay. And yet, I think for the first question, I just to give you like the overview of what the generative AI can do in the medical field today. But in fact, there are many AI, like the AI to do in the MRI scan, or the AI to do in many language that I think yeah, we can talk later. Thank you. ครับขอบคุณครับ
Well, thank you, Piyalit, to make us understand more about AI and not just health services in general or telemedicine or trade. And I have heard in Thailand, we once tried to promote humanized healthcare. And when talking about AI, I feel like it's not possible that healthcare become humanized by AI. But as he said that AI can help doctor talk to the patients, at least look at patients' eyes and discuss as a human touch like that. So this is a nice thing of AI, but definitely AI is not only good things. There are many issues to concern. So come to Australia, because Australia is very well advanced in AI technology. This is for sure. But on top of that, Australia has well prepared to respond to AI in health services as well. So I would like to invite Farah to tell us about what Australia is doing to enhance health services as well as to protect patients' rights. Thank you.
Great. Thanks very much for the invitation to participate in this session today. So I'm here also representing the Australian Alliance for AI in Healthcare. The Australian Alliance is essentially a group of, it's a coalition of the willing, essentially all of the stakeholders around the country who have gotten together to accelerate the adoption of AI in healthcare. We've heard today the possibilities are enormous. We have significant challenges in our health systems, whether it's Australia or anywhere else in the world. And so the Alliance came together in 2018. And so it's been active for a number of years now. We've released 2 policy roadmaps, and I'm going to talk about that a little bit today. So the approach that we've taken in Australia has been very pragmatic and problem-driven, in the sense that we're coming out of COVID. Our health systems are under enormous pressure. we don't have enough primary care doctors or GPs. And even if you see a GP, they are spending most of the time looking at their computer. They're not focusing in on the patient. We have, even in hospitals, the doctors and nurses are drowning in this weight of documentation. So they're spending time after hours, weekends to catch up with documentation. And unfortunately, many practitioners are actually leaving the system. So that's one big issue in Australia that we're trying to tackle as well. So it's kind of like against that background that we have said, look, what do we need to harness AI and solve some of the intractable problems in our health systems? And so that's what I'm going to kind of go into today. So this was a report that came out earlier last year. This is the Productivity Commission. Essentially, they did a big research study, and they said that we need to solve our healthcare problems by integrating digital health and AI. It could save the country huge amounts of money every year. And most importantly, it could ease pressures in the system by saving up to about 30% of worker time. So the impetus to adopt AI has been shown. So this is very evidence-based. We also have a whole of economy approach. So don't forget that it's not just about AI in healthcare, but nations and countries are looking at AI broadly across all sectors. And so anything that we do in healthcare needs to fit with the whole of economy approach. And so in Australia, we had work that is happening across all industries looking to see. So the EU regulation that was presented by earlier speakers is a whole of economy approach. And so Australia has its own whole of economy approach as well. And one of the things that we need to think about for healthcare is how do we support and promote best practice governance in healthcare already. And so one of the things we need to realize is that when we're looking at a whole of economy approach, we're introducing AI into many sectors where there has not been which are not very tightly governed. And if you contrast that with health, health is highly governed, it's highly regulated. So we need to be careful with being too I guess, prescriptive about what we do about governance, because there is already a lot of governance that is happening. And so how do we carefully integrate what we need for AI rather than, add more burden for the workers on the ground? And that's the governance aspect of it is extremely important because, there's a race going on to build the most powerful AI. 2 days ago, China announced their own version of ChatGPT, which is supposedly more powerful. And so the focus has been pretty much on build the most powerful AI, and the approach has been move fast and break. But in healthcare, we do not want to move fast and break in some ways, because what you break then are people. And so we need to kind of tread carefully and sort of see where the problems are, and we want to harness AI and use it, but then also do it carefully. So we now have a voluntary AI safety standard that is in place. So this is across all industries. It's voluntary, and like all good governance, it comes in voluntary, and then we expect that this in a few years' time will become mandatory. But everything on this list in terms of the safety standards, it's very consistent with a lot of governance that already happens in healthcare. So it's very easy if you go through systematically and do an analysis, we do a lot of these things already in healthcare. So it's not hard to add AI on top of that. And so there is a broader conversation nationally about what do we need to do about AI across all sectors. In healthcare specifically, I want to sort of start with the patient and consumer perspective. So what do Australian consumers think about AI in healthcare, and do they want it, or do they see a place for it at all? And so I was very privileged to be part of this study. So this was a citizens jury that was held in Australia. Citizens jury is a very rigorous evidence-based process. You don't just go out and interview or survey a random set of consumers, but you actually recruit a representative sample of people from across the country. you spend time with them, educating them about AI, and then they come together face to face to deliberate. So in Australia, we were privileged enough to have one of these juries. And let me show you. So this is the paper which reports the findings of the jury. And the headline item here is that Australians welcome the clinical application of AI in healthcare, provided strong governance is in place. And they recommended a coherent sort of national approach. So this paper is available online if you'd like to go and have a look. And it details all of the recommendations of the jury. And I think this is quite unique because no other country has had this approach to looking at a consumer perspective of AI. And this is it. This is the jury. This is Australia in a room. And it was a fascinating experience. So as you can see, it was a representative population. We're quite a diverse population. And you have one of the each kind of group around the world, including First Nations people. This is how they came together over 3 days on the weekend to sort of deliberate and come up with the recommendations. The recommendations are in 15, there are 15 recommendations in 10 categories. And so those are the broader categories. But this is it. So the recurring sort of themes are that we need to evaluate, we need to have integrity around these things, we need to be transparent. We need to be fair. So they want AI to kind of be implemented, but nobody left behind. So it's not AI only for those who are digitally enabled and are digitally literate. And so that was kind of the consumer perspective. And this is the national policy roadmap that was released back in 2024. I'm sort of need to be careful here. At the end of 2023, I'm sort of still a year behind. It's the new year. The national policy roadmap. So this was a second sort of iteration. So essentially the approach here was, again, a very broad consultation with stakeholders across the sector to kind of come together and say, look, what do we need to have in place in terms of policy to ensure we adopt AI? So it was not about coming up with new policy, but what settings do we need to change in our existing policy to add AI to what we're already doing. So the roadmap has 16 recommendations in 5 areas. No surprise, safety, quality, ethics, and security was the top priority across all of the stakeholders. Workforce was really important because we need a workforce who is able to use AI. The consumer perspective was the third. And also sort of industry was important because we have a growing industry and the startups are kind of, so how do we support that industry in terms of providing them with the data that they need and access to representative sets of data. And of course, we need to have research as part of that agenda. So the roadmap looks something like this. These are all of the 16 recommendations, and I'm not going to go through that in detail today, but I just want to highlight the safety, quality, and ethics. So essentially, the safety, quality, ethics, it talks about minimum standards of practice. It talks about communicating the caution around generative AI, which has already been addressed, and sort of having a national framework for AI ethics. And so each of these recommendations, they build upon existing things that we already have in place and stakeholders have identified as, look, that's the tweak you need for AI. The other thing we have seen in the last 12 months is the rapid uptake of digital scribes. So all of the scribes, essentially, this is the AI, which is listening to the doctor-patient consultations and then generating either a summary for the record, or it's generating a patient note or patient education. That has been rapidly adopted across the nation. All of our primary care doctors, about 90% of them use computers in their consultation rooms, and the top 2 providers of those software for those consultations, they now have generative AI integrated into the software. So it's not a separate thing that doctors, so it's available to them on their desktops, and it's estimated that about 50% of GPs are already either using AI scribes or they're thinking about using scribes. And so these scribes have essentially been built and they're available within the software, but they haven't been through any kind of safety checks or performance. There's no evidence. I mean, it works. And so it's like you take it on trust that it works, but there hasn't been a study that shows that this works effectively and it actually performs up to the standard that we need, because they're not subject to any kind of regulation. They fall outside the current medical device regulation. So this is that tension where we now have software that is being provided to doctors because record keeping software was never regulated under the SMB regulations that Manisha talked about earlier on. And so because it's record keeping software, it's not subject to any regulation, but what that means is anybody could be designing these and making them available to healthcare practitioners. And there's, without even proving that they work. They work fantastically well, but they also have this issue of hallucination. So what do we do about that? And so the Australian Commission for Quality and Safety in Healthcare, so this is our national agency for patient safety. They commissioned this work that was done by me and my team. We did a very comprehensive literature review about the evidence that is available for AI in healthcare and an environmental scan as well. And so from this work is going to come out guidance for healthcare practitioners on how to use AI safely. So whether it's generative AI or the traditional machine learning models, the X-ray, assistive AI, and so they're going to put out guidance that will come out in the next 6 months. And so this work will inform the guidance that will be available nationally. The other thing is our College of GPs has published a guidance specifically around scribes because our GPs were already using transcribing software. And so many of them, when they're picking up this AI scribes, they don't realize the difference between transcription and the summary note, and the fact that they actually need to check the note and verify that it is correct. This is the national agency which regulates healthcare practitioners. Again, they've reminded doctors about their professional obligations when using AI, and so they put out guidance last year as well. This is actually quite a nice piece of guidance because it talks about the key principles for healthcare professionals. The fact that they're responsible for delivering safe and quality care, not the manufacturer or the supplier of the software. They need to understand enough about the AI to use it safely and meet their professional obligations. They need to be transparent with their patients. They need to seek informed consent, that if a patient comes in and says, well, I actually don't want you to use that scribe, then they need to be able to provide the service without using that scribe as well. And they have to seek informed consent. They also need to think about the ethics and legal obligations, because in case the scribe has hallucinated and an error has cropped into the record, and then somebody else makes a decision based on that error, erroneous record, then there are ethical and legal implications as well. So ultimately, at the moment, the way the regulations stand is that it's the provider who is ultimately responsible for what goes into the record, because that's a legal document. And so there's a little bit of work here to be done in terms of who's liable if a mistake crops up in the scribe. But I think it's going to be a case of where we have something in place and it's going to need to be updated as the technology evolves and gets better. So let me stop there, and I think we'll leave some time for questions.
Thank you very much, because I think your research is very useful. When I listen to all panelists, and not just this room, but other room, I'm questioning, where is patients, where is consumer, where is real people about in AI industry, in health service industry. But your research mentioned about these people. You have citizen juries, you have when you're doing roadmap, national roadmap, you consult people. Because my background is about participation in policy process. I try to move forward the issue of social participation, which is one of WHA resolution as well. And I think this area, AI in health services, AI in international trade, people are missed out. None of us understand, all of you told everything from your presentation, because AI itself is quite still difficult issue, both in terms of the language and the contents. That's why people, patients, consumer are left out. So this is another point, that not just concerned about professional, health professional or AI developer, but consumers like me, who do only online shopping, also need to understand it as well. Thank you very much. But I would like to open the floor to everyone to maybe share your experience related to AI in your daily life, in your hospital, or any questions or simple questions. Thank you very much. Before you're asking the question, can you introduce yourself to us, please?
Hello, good afternoon. I'm Dr. Kate Telenko. I'm a health workforce expert. I'm the CEO of Corvus Health, which is a global health workforce firm. I previously served as the head of the USAID's Global Health Workforce Project. And some of my biggest concerns are of legal liability for professionals in AI, especially if a hospital says you must use this AI, or this AI is built into your workflow. So in order to see 30 patients a day, you have to use it, because if you don't use it, you'd be there, all night. Because as you said, in all the legal frameworks, currently it's under the physician's license. The physician is legally responsible. And we're setting physicians up to fail. We're setting them up for ridiculous legal liability. And this is something I'm very concerned about. And I'm wondering if you've heard about legal frameworks that are sort of moving into the right direction, shifting some of the legal responsibility on the corporations. So, we have something in the US called corporate practice of medicine, which is illegal. It's like, I'm a physician, my employer can't actually tell me what to do, but they actually do it all the time. And sometimes it crosses a line, and physicians win lawsuits over that. So I was wondering if people have anything to say about legal frameworks they see moving in the right direction to share that accountability, to take some of that legal burden off of physicians. Because it's really scary. Yeah.
Anyone of you, maybe we use the microphone because it's online as well.
Look, I'm not a legal expert by any means, but I can share a little bit about what I know. And I think what we need to realize is it can cut both ways, right? So by not using the AI, I could actually be posing a risk to my patient, because using the AI would make me a better practitioner in terms of, finding all the polyps that the AI is showing me. And so that's the first point, that it can cut both ways. In terms of, so I think that's it, right? So I think in some specialties where it has been, there is a lot more evidence, and this is the imaging intensive specialties, that AI is starting to become the standard of care, that using AI as an assistive, in an assistive mode, is starting to become the standard of care, right? And
if I'm a radiologist and AI back and look at the,
you can verify it, yeah.
Your ICU and
no, so oh, I completely agree with you. And so that's a different kind of AI that you're talking about, ICU, where, and all of the ones we've seen, they are largely assistive. So in the sense that, and even if you look at so we've done quite a bit of work trawling the FDA's database of approved devices and looking at what are these devices doing. And 50% of them are assistive, in the sense that it clearly says that this AI is not intended to replace the clinician. It is only, this is in simple language, that it's meant to be a second pair of eyes. It's not replacing you, and you need to be very clear about what it's doing. So even if it's looking at a particular artery, you're responsible for looking at all of the others. And each AI is quite different because there's not a lot of standards out there. And so each device is different. So say you're using an AI in one hospital, it's looking at certain arteries. If you can't go to another hospital that also is using another slightly different kind of AI and assume it's the same thing, because it's not. Each manufacturer does things slightly differently. So that's the first thing. Going back to your original question about legal liability, what I've heard in conversations is that it's moving to an approach where it's shared, where the responsibility will be shared. But the thing is, it all depends, again, on what's the role of the AI. So if it's a second pair of eyes, then it's going to be the provider. The other thing to say there is also, there is a lot of work being done in terms of organizational governance. So what are the policies and procedures that a hospital would have in place to ensure that its AI is working up to a certain standard? And a lot more work needs to be done in that space, because what's happening is, even if you have a device that has gone through a regulatory process, that's just the device. I need to bring it into my hospital. I need to plug it into my EHR. I need to plug it into the other systems and ensure that it is working properly. Some work that we've done on the safety events reported to the FDA as well. We went back and looked at 6 years worth of data. Yes, there are some algorithm issues that in the safety events, but 80% of the issues related, so these are safety problems involving AI, they relate to poor data being fed into the systems. So it comes back to what are you plugging it into? What are your procedures for using it safely? And so that's why we're focusing a lot on guidance for clinicians around, look, you need to know what this is and you need to know how to use it safely. It's not your standard thing where, you know, in the old days, you could never get clinicians to go to training to use the EHR safely. Yeah, and so I think it's about, like, it's not just about, oh, I can figure this out as I go. It's not. You need to know what this does and what it doesn't do and how to use it safely before you're allowed to use. So there needs to be a minimum competency almost in safe use.
Thank you. It's nice conversation, but if you have anyone, we still have, we can have one more question if you like. All right. Oh, thank you.
Okay, actually, since actually I don't have any background about the AI, but I'm really interested why this topic is so popular these days. And I also want to know whether it's necessary for my future career and also I think it's necessary for my own life, but I'm not quite sure whether it's necessary for my career. Regarding to all of this presentation, I mean, I really appreciate all of this effort and also this great presentation. I think I heard that the good AI, I mean, linked to the AI to health service, we can save the time and also save the cost, and also how to say, can encourage the individual involvement in such service. That's really nice. But I want to know, for us, the one who don't have any of the background, how long or how far we can be involved in such, I mean, activity. And for example, if I want to develop some of the research project, how can I initiate? I mean, shall I seek some of the AI specialists and then to start my research project or some community engagement campaign? But could you please share some of your idea? How can I start my project? Something like that. Thank you so much.
How can you start your project by using AI?
I mean,
to help?
something like, I mean, just go back to the topic today. But if for me, the beginner, I don't have any of, I mean, the background of AI, but I want to work with AI in the future. How can I start my own career or my project? Thank you.
May I start with perhaps Pialit can give you an idea, because his background is medical doctor, not related to AI before, but finally he's end up working on AI and health services. Let's hear from his experience.
Oh yeah, but I think it's maybe not that, because when I was young, I compete in the computer Olympiad. Yeah, so I have some background. Yeah, but I think it is a good question. In fact, I think for the AI, I think you don't have to start from use the AI in the medicine. In fact, there are many tasks. I mean for everyone, like the summarize the news, or the you can like find the information to do the literature review. That nowadays, for example, we have the Gemini 1.5 deep research that you just give your hypothesis in the Gemini, and it can find the many evidence and to do the I can say that it's a quick literature review for you with the evidence support. I think it's a very strong, so that you can like normally you may need to find in the Google Scholar and need like 2 days to know about the one question. Yet, but with the Google Deep Research, you can do it in just 5 minutes. Yeah, but for me, in the Thai setting, I think first, I think maybe you need to look into like your daily life, that what thing do you think we can it's a repetitive task, the first one, and the second, do you think this is a complex or not? If it's not complex, normally the AI, that especially for the agentic AI in this era, it can replace you. Like for example, for nowadays for the email, yeah, to be honest, I asked AI to draft the email for me for all, and I think it shortened time for me. Like normally I have like the 100 email per day. Normally I need like the 1 hour and 30 minutes to solve, but now it's just only the 20 minutes, because my AI draft email to respond for me. I just click this one is okay, this one is okay, something like that. Yeah, but the thing that I want to talk now, I'm not sure about the in the next few years, and I have conflict of interest, because I mean I also work part-time with some project of the OpenAI. Yeah, but what I concern is about the artificial general intelligence, or the AGI, that I really don't sure that in a few months, or in the next year, if the AGI come, I think the many job will be affect significantly. Yeah, so I think you need to like to know more about the if AGI come, what will happen, and how you get see this as the opportunity, not the threat. I think it will help you. And finally, in Thailand, if you want to do somebody, I think at the Chulalongkorn there are many AI experts. I think the Chulalongkorn open to like the computer engineer that many of my friends live there. I think you can contact them with email. You have some idea and ask them to be the collaboration, because nowadays to make the one AI, I think it's not hard as before, because for example, some of my AI project that, for example, my thesis that I do 2 years ago, I write the program for the 3 months. Yeah, but now with the O3 model, I just type in the 5 minutes and it generates code that nearly can run my thesis. So I think the AI is really good at coding now. So if you just talk with a computer engineer friend, I think they can help you. Thank you. Sorry for my speaking. I'm really feels tired now. Okay.
Okay. So after this meeting, you can go to sleep. Now I allow you. Or otherwise, you can ask next. I will ask question to AI. Let AI answer my question. Oh, but by the way, we still have one more question from online. Can the MC read the question for us, please?
Yeah, thank you very much. This is very fruitful discussion. And there is one particular question from online. And I think since we talked about the harmonization of the country in telemedicine at the first stage of the discussion, so the online participant asked about, should we support cross-border telemedicine, or should be the issue of country by country? And I think this is a very interesting question. Maybe it goes directly to Rupa.
Okay, so I don't think it's a question of whether we support cross-border telemedicine or not. Markets, will drive cross-border telemedicine. If consumers on one side find shortage at home, they find good providers somewhere else. It's a question of trust, acceptance, all of those things, and the readiness. But I don't think it's a question of, again, national versus across borders. The national development has to support the cross border because the readiness won't be there. That point is there. But on standards and so on, I think because in trade, the mutual sort of acceptance of standards, some sort of equivalence, it cuts across many different kinds of services. It could be in terms of recognition of credentials. It could be in terms of the data systems and so on. So that level of harmonization would be required. Now, to the extent at the national level, countries look at best practices, they look at possible alignment with international standards and regulations and so on, that will make it a lot easier. So the point I was trying to make is that you can use more and more of global and regional, sub-regional sort of platforms, mechanisms, forums, and so on to do this kind of alignment. So these DFAs, DPAs, and things like that will actually help that process. Okay, so it's not this versus that.
Okay.
Say one thing, I was listening to the conversation
Yes,
earlier
please.
on liability, because telemedicine also liability. What it's saying is that really you need so much more integration into the curriculum itself of these issues. That's the starting point, really, to build AI into national curricula. And again, having some sort of cross-border collaboration on that.
Because, yes. Can you use the microphone? Because
your mentioning of telemedicine in that context made me think of a question. In the US, the care occurs where the patient is. And so if there's to be a legal suit, it's where the patient is. What framework are most countries adopting around telemedicine regarding that? There isn't. So most countries don't have a framework on.
So that's why, things like teleconsultations and so on, fine, because you'll have a second opinion. Similarly, in teleradiology, in many countries, in fact, there's a lot of teleradiology, for instance, done overseas from India, for instance, but because one is your credentials may not be recognized, or you may be just the sort of the ghost reporter, and then there is a second thing. So that takes away the liability. Otherwise, it gets into a different domain of services, actually, which is on legal services related, harmonization, and that's a very difficult one. So where will the liability, if there is a case, where will it be tried? In the consumer's jurisdiction or the provider's jurisdiction? So again, coming back to, I was saying on education and so on, a lot of these things today and cross-border are working in the corporate sector, between establishments. So I know of cases, for instance, like the Singapore government has actually come to India and looked at various establishments and recognized them for being able to provide cross-border telemedicine. So you need some sort of these kind of bilateral or sub-regional efforts to bring together that alignment.
Right. I think I cannot end these sessions by asking, as a consumer of AI and health services, how to make a consumer feel safe in all means, from both AI or health services, or even through international trade. So would the participants, who would you like to start first?
Look, I think it goes back to a little bit of what we already have, right? There are standards in place. So the Joint Commission for Accreditation, that's the US body, it accredits a lot of hospitals in other countries. So a lot of Indian organizations, for example, have JCO accreditation. In Malaysia, it's quite popular. So I think it's a case then. So if an organization is using AI, then how do you integrate that into those accreditation requirements? So that's essentially what we're doing in Australia at the national level. So our patient safety agency accredits organizations for following the national standards. And so how do you integrate AI into those standards? Because it's a tool for providing services. And so you'll have the clinical standard, and then you have a technical standard, which says, oh, you have to have all of these security and other considerations in place if you're using these tools.
Right.
So that's kind of what I think.
Right. Safe for me is not only AI. Safe for me not only on AI and healthcare, in the sense that it could be like cybersecurity or call center that we have a lot in Thailand as well. How related to what you work, any suggestions, or you would think of collaboration on something?
I think it goes back to what Farah was saying earlier, which is that, health is one sector in which you're looking at the application of AI. You actually need to look across sectors. There'll be certain common guidelines, principles, and there are certain areas where you do have international standards and frameworks. So unless you take that holistic sort of approach, and then you may need carve outs and so on for particular sectors, particular types of data. So I think the conversation has to be first about broader digital governance and ethics and cybersecurity, all of that, and then tailor it to certain things required for specific sectors, because the financial sector is another one, very, very important in terms of sensitive data.
Thank you. Governance, holistic approach. So, yes, please.
I'd just like to say that AI is at the root an enabler. We are already having a number of transactions which we are doing under existing legal and other obligations. The question is how to use the advantages of AI being quicker, greater precision, and to bring about better accuracy in the decision-making process in healthcare. And as I had also mentioned, it is really something which is which will, you yourself mentioned that regulation is much later because the activity is already taken place. And that is the nature of regulation, because one doesn't know what to regulate till the activity is there to regulate it. And AI is in that space because it is going in different directions across different sectors, and whether it is the energy sector or the health sector or other the socio-environmental areas. So I think as an enabler, it is the basic standards have been set out even in the UN and the WHO documents, where it says that the ethical principles need to be maintained. How it moves around that will depend on the kind of collaborations that develop, whether within the private agencies like the manufacturers of medicines and medical devices, and across different jurisdictions, and also with the governments. And I think in terms of the liability, this is a very, very difficult issue. If you remember, even during COVID-19, when the vaccines were already ready to be dispatched, we still had a 3 to 4 months delay because of the indemnity clauses, which were not getting signed because the countries didn't know the whole legal bandwidth of what they were actually signing on. And it took a long time in the COVAX program also to get it going. So I think the legal content and how the liability issues get decided will really require some more global consideration in terms of different areas. And for that, the different agencies like the ICDRA or the IMDRF, which are concerned with medical devices, hopefully as they come around to discussions with AI, they should be able to define the basic parameters around which the national laws can then evolve to address these issues.
Oh, thank you. Enabling environment. This is also important. Liability on lots of issues is needed to address. And would you like to add on something?
Yeah, for me, I think the last one that I think many people fear about the generative AI is about the can we use the generative AI to do something that is not good? Like this, I think many of you may try to ask how to make bomb at the ChatGPT or the other model. In fact, it's called the jailbait. I mean, for the technical word. Yet, but in fact, nowadays there are like the many people take care about the safety of the any AI model, especially for the large language model, and also for the medical, like the sometimes people try to teach the model like the like the some duck is good, but it's a bad duck, something like that. Yet, but what I concern is about the open source model. I mean that sometimes like the open source model from the Llama, I mean from the Facebook, they have like a very strict strategy to train the large language model. But for nowadays, I see many open source model that yeah, I understand it's very powerful. Yeah, but for example, a DeepSeek model a few days ago that just came out and it's the first ranking in the App Store now. Many of my friends try to do the jailbreak of the DeepSeek, and it's really easy to jailbreak that and ask about the prohibiting in the Chinese, something like that, and we can do that. So I think if so in my opinion, I think for the for the two sides first, for the like the general AI aspect, I think we need to do more regulate about the using generative AI in the long way. But for the medical, I think we need like the more regulation, because it's very easy to fine tune some model to give long information about the medical thing. So I think the way to evaluate the large language model, I think we need a framework that should be collaborate around the world, not just see the report, because I want to say to you, if I want to use the model, large language model, to get the 100% or the user mind, I just can make the result or the fine tune with the exam paper. So I think we need to have the good framework to surely validate that the model is not just the overfit with the questionnaire or with the exam, but should generalize and safety for the clinical profession to use that.
Right, thank you. I think it's more like a collaboration and framework to work together, not just like reading papers and make it happen.
Yeah.
And so I would like right now is 4 o'clock something, and I sorry that I don't have a break for you to get a coffee. So I will finish these sessions earlier so that you hopefully get some coffee and snacks for your afternoon. I would like to hand over to our MC. Thank you.
Yeah, thank you very much. This is one of the fruitful discussions that we have ever had, and we have covered so many topics for today. And on behalf of the National Commission on International Trade Studies and International Trade and Health Program, International Health Policy Program, I would like to express my gratitude and give you a big thanks for joining us for the site meeting today. And we have enriched our AI technology knowledge a lot. And before we end the session, may I please invite all of the speakers in front, and also the moderator as well. We have like a little bit special souvenir for you, just to say thank you for your information, which is very useful for our future prospects. And of course, when we talk about AI, we need a lot of framework and regulations that we must govern technology, not to let technology govern us. This is very nice quote. I love it. Yeah, so please. I would like to invite the organizers as well, so we can give to the speakers, which is the best position for ตรงไหนดีครับที่จะถ่ายรูปได้สวยตรงกลางอ๋อได้ครับได้ครับสวยงามครับ All right, so we are going to move here for a little bit photo. Yes. ตรงนี้ก็ได้นะครับได้ครับ So may I please okay เอาเลย May I please invite first Dr. Rupa Chanda for Next, Professor Farah Makrabi, please. Please. And next, may I invite Dr. Manisha Shodhar for giving you a very special gift here. Oh, it's okay. We will have like together. Yeah, one by one, and then we will have together. ได้ครับ Oh, we. Oh. Oh. Yeah, right. Switch here. Thank you นะครับ Oh, okay, okay.
Just a device that's been approved, you have to plug it into the system in the hospital.
Oh, sorry. And the last one, may I invite Dr. Piyalit Ithichaywong ครับ
Yeah, yeah. The tool is only useful to you if you have the time to use it or time to like.
ขอบคุณนะครับ And the last one, our moderator for today, who moderate very well this session, Miss Nanut Maturapot. ครับขอบคุณนะครับ ขอบคุณมากนะครับเอ่อถ่ายรูปหมู่หน่อยไหมครับ อะไรนะครับ อ๋อ ไม่ close แล้วครับ ได้ครับ Okay. Okay, may I just lastly invite everyone to have a group photo together and maybe just all these figures, please. Yeah, here, please. Yes. With the moderator and Dr. Bialit as well. เอาเลยครับ Tony, maybe here is the best position for, yes. Last one, please. ไปฝั่งนู้นได้ Thank you very much นะครับ อันนี้ this is all for today. Thank you very much.